It's been a long time since I've said hi. So, hi. Welcome to Dialogues with Mayank. This is episode 2. Now, there is a phenomenon called the illusion of explanatory depth. The illusion that we understand things better than we actually do. We all have this illusion. We think we understand how things actually work, even when we don't. It's true for politics, it's true for economics, it's true even for pandemics. Now, if you really want to understand something, try explaining it to others. Try having conversations. Try having dialogues, which is exactly what we do in this podcast series. Following the conversation with Dr. Sushant on our current situation of COVID, Dr. Sushant, I'll say, in this war with COVID, is our frontline warrior who is fighting this war for us. Now, he talks about a lot of things in and around COVID. He talks about the hyped up medicine remdesivir, he talks about plasma donation, vaccination drive, he talks about his own experience with COVID and what he thinks how things are unfolding. And it's sad to know that even he feels that we are really ungrateful to all the doctors. So the least thing that you can do here is listen to this conversation, then go show some love to Dr. Sushant, show some love to all the doctors that you know, tell them how grateful you are, put a smile on their face, follow all the safety measures, and stay safe. So every time we have had a conversation, the word COVID has popped up. I hope this does not continue longer. But right now, all we can do is hope and pray. So that is why, Sushant, we have brought you today so that we can get a bigger picture on what exactly COVID is. So even for us and also for our audience, can you please introduce yourself?
Hi, I am Dr. Sushant Aildasani, and right now I'm based in Lucknow. I am doing my DM Neurology final year, and simultaneously during this pandemic time, since 1.5 years, we've been working in COVID ICUs on the rotational basis. And day in and day out, I get queries about COVID myths. I see social media thronging with requests for remdesivir, plasma, oxygen beds. So for that, I just thought that I should come here, try bursting some of the myths of the people regarding COVID, and try bringing them the notice that what all the doctors, especially the junior doctors over the globe, have been putting in this pandemic since it started, since 1.5 years. So yeah, here I am.
So we have many views on this topic, but obviously a doctor's view is much more important. So before we start, I just one question. What should we call you? Dr. Sushant, or just doctor?
Call me anything. Call me Sushant. It's fine.
Okay.
You already introduced me as doctor. Call me Sushant.
And guessing from your Instagram bio, you also play guitar. So one more myth that's busted for doctors.
Doctors have all these extracurricular activities. Since our MBBS training, we are made to take one of these things either as sports or these music or debate as a hobby. I am a debater. I play cricket. I play badminton, guitar. We used to have a band in Bombay during my MBBS days. So, ऐसा नहीं है. Being a doctor is not only about academics.
I think doctors and cops should have extracurricular activities in their life because the job gets so stressful. You need
it definitely helps. It definitely helps.
Yeah.
I think everyone should have something.
Sure. Yeah. That's coming from a doctor, neurologist.
And also, obviously, this podcast is not the only thing they're doing for helping people. You're taking calls, you are present in the hospital.
Yeah. So last week it happened. I was doing my COVID duty and it was day 9 of my duty in ICU. And after coming, I had a bit of running nose. Next day I developed cough. So I got suspicious, got myself tested. COVID.
Okay.
Unfortunately, the report, it came out positive. So I had to quarantine myself, couldn't resume my duties. But then seeing the greater situation, I thought if I can't go, I can at least through social media, I can guide people, teleconsultations, telemedicine. Like people are I'm not finding it easy to approach doctors daily. I'm seeing requests of influencers that patient require help, and also I thought,
Right.
why not to utilize my time in doing the same which I was doing in the COVID ward without even
Right.
going there. If I'm able to help people, the motto is achieved. So therefore, I put out a post on Instagram that anyone seeking help could contact me.
Yes, and thanks to Instagram because that is where we found you.
Yeah.
You wanna give out your Instagram handles or Twitter handles for our listeners where they can find you?
At present, I'm not on Twitter, but my Instagram handle is Dr. Sushant Aildasani. That's small dr SUSHANTAILDASANI. Dr.
And we'll
Sushant
also link it
Aildasani.
with the podcast. So
Yeah, we'll tag you in
sure.
the description
Thank
and the description as well.
So moving
thank
on
you.
to our topic that we have, as far as I know, COVID is the disease and the virus is SARS-CoV-2, right? CoV-2.
Yeah, SARS-CoV-2. Yeah.
Okay, so one question which is obviously very stupid, but people actually ask this. That's why I'm asking you: is COVID real? I know you'll be pissed by this question, but I just want you to answer it.
No, COVID. I mean, what to tell, but still, I will say in simple line, yes, COVID is real. And until and unless it happens to your near ones, your family, or until unless you are directly linked to it, people might find it unreal. They might find it a government policy or a government failure, or in other parallel world, they've seen something of hospital and doctors money minting thing. But they realize once it occurs or it happens to them or their family or their near ones, or if they are directly associated with it. So it's not about person. I also have friends and initial family members who initial days used to ask me about these questions. But since they've seen me trogging through it since 1.5 years and they have seen the cases in the near and dear ones, so now they know that COVID is real and it is shit real.
And even though it's a very unfortunate incident, I mean, this pandemic, but still it looks very well planned because I was reading. So when this outbreak happened in China, it was the Chinese Lunar Year. So it was their travel festival. So at that same time, people were moving out of Wuhan. They were traveling everywhere. And that was the time this outbreak started.
No, so now it is very difficult for us to, pinpoint on the cause, because even WHO has not been able to pinpoint on the cause despite having so much of resources in that. There are various theories linking to the seafood market in Wuhan. Some theories considered it as a method of bioterrorism. Some consider it to be a man-made coming from bats. So there are various theories. None have been proven or certified by any authority in the world so far. So I don't think, and now whatever the cause was, it's causing harm. So rather than debating about what caused COVID, I think our efforts and energy must be to how to curtail it. That's my view.
Because all we know for certain, I guess, is that it started in Wuhan. That's it.
Yeah.
How it started.
Yeah, that was the epicenter. How it started.
All of that is still debatable for some people.
Yeah, it is definitely debatable.
And even though it spread to the entire world, but right now, seeing the current situation, we can clearly see that our country is the worst hit, right?
So now if we see the trajectory of the COVID since it started in December 2019 in China, it has followed a certain trajectory. Like from China, the first few countries to be affected were the Western countries and the Gulf countries like Iran. Till then, in India, we didn't have any case. The first case in India, I suppose it came around 30th of January.
Okay, January.
30th of January was the first case in Kerala, which was detected. Yeah, so as a wave, it started rising in March.
Oh, okay.
Because Italy, at the start of the pandemic, Italy was the worst hit country, and I think the reasons were because there were Italy has the most number of joint families living under one roof. It has the oldest population in the world, going by percentage, and it has the highest number of smokers in the world. If we go by percentage. So what do you think are the reasons that the second wave has hit India so bad?
See, there can be many reasons. One reason is this, like in first wave, we all saw that the major chunk of the population affected were the elderly. The young were affected, but to a lesser extent. Either they were mildly asymptomatic or asymptomatic, but we didn't see much more mortality in them. See, when I'm talking about all these things, I won't be considering government's data because I'm not sure how accurate and how deep it is. But this is what which I see and I hear and I take queries. So last year, majority of the people consulting me were 45 or 45 plus, maybe 50, 60, 70. Rarely anyone of the age group of 35 to 40 or 30 to 40, I heard. But this time, even young as 4 years kids, 3 years kids are having symptoms of severe headache. So one, this is affecting young population. And as we know, the major chunk of India's population is still young. If you go on roads, you will find people violating the lockdowns, getting married, unmasking, social distancing. I mean, in November and December, when this COVID started coming down, well, there were parties. There were parties in Goa. There were parties everywhere. There were marriages. There were no social distancing. We used to be so furious seeing people on the roads coming out without mask. And I remember constantly keep telling people that, listen, the war has not been ended. You need to mask up. We need to follow the COVID related protocols. But I mean, we didn't follow. So if the government and the politicians and those people are to be blamed, I think the public has themselves to be also blamed for.
Right. So first of all, it truly is a war. And the second, so answering Dheeraj's question, what I think is, we here in India, we only believe in gods. We don't believe in anything else. So even though the COVID was so deadly, we had seen in the first wave in Italy and countries in and around, but still we were like, there's nothing. It's common cold. It's like any viral fever, it'll go away. And even if you see now, I've seen people still asking questions about COVID, whether it's real or not. So even though all of this is happening, people are still not believing that this is real. They think this is some conspiracy, some agenda.
Some agenda, some conspiracy, some hospital motive, some government motive. Elections are coming. Government needs some distractions. This is what I'm hearing.
Right. Plus, we are a country of 1.3 billion people. It's very hard to manage this lot of population. So what in the start, I think government did was they advised, they recommended, but I don't think we follow advices and recommendations. So it's all started slipping down.
Yeah, we still don't follow the recommendations. Okay, I agree. This wave, this virus was new, novel COVID virus. The government didn't have any knowledge about it. The world agencies, WHO, ICMR didn't have any knowledge about it initially. The guidelines keep on changing. The protocols keep on changing. But the one thing everyone has maintained since the onset is two weapons: mask, social distancing. Avoid going to public places. Even if you have to go for important purposes, wear appropriate masks. That is it. Two things which have maintained, which have been steady throughout the world, throughout the health agencies and and I think we as a country somewhere fail to follow the basic two things. I mean, that's what I feel when we talk about prevention of COVID.
Right. So if you look at it, it's actually very simple. You can sit at your home, you can wear a mask when you're going out, you can keep social distancing, and that's all. That's all is required for now. But we're still feeling at it.
Yeah.
So masks, social distancing, and also now I see posts about some medicines like remdesivir. So people are going crazy about some medicines, I don't think everyone knows how important or not important that medicine is. So can you tell us more about, is remdesivir actually, is it actually helping curing COVID, or it's like the toilet papers that people were buying? when the first phase started?
Okay. So now if you want to know about the treatment, it's important to learn the basic mechanism why what COVID is causing in your body and how the complications are occurring. To keep it simple for everyone to understand, I'll say during the first 5 to 6 days, when the virus is in your body, the virus starts replicating, increasing, and the virus causes damage. 6 days onwards, it's the body immune system. It's the immune response to that virus that is causing all those harm. All the words that we know, that the cytokine storm, the inflammation, are caused due to body's immune response to the virus agent. The work of virus is for the initial 5 to 6 days. Next phase is the body's immune response towards it. So the drugs have to be started appropriately. In the initial few days, the drugs that is used to control the virus replication, to decrease the viral load are required. But once the initial days have passed, the disease have progressed, the drugs, even if you control the virus load, your body immune system, that cytokine storm, that inflammation, which is hampering, which is causing all the complication, that needs to be controlled. If that is not controlled, no matter how much antivirals you give, you will have complications. So coming to remdesivir, all this hula hoop around remdesivir. So first we need to understand its mechanism of action and how it was discovered and what the trials were there. So the initial trial which showed remdesivir use in coronavirus, its endpoint was not improvement in patients or treatment. It was just the decrease in the hospital stay or decrease in the viral load or the early recovery. That was the endpoint. Now you think, if the endpoint is not the improvement of the patients or cure of the disease, how can remdesivir help in improving or curing of the disease? The remdesivir, one, it is effective if only it is given in the earlier diseases, early stage of disease, like in the initial 5 to 6 days, or the patient still has mild disease or a moderate disease requiring oxygen. One, it has no rule in asymptomatic and mildly symptomatic disease. It is required if a patient is on minimal oxygen support or has impending respiratory failure of SpO2 between 90 to 94 and the cytokine storm or the inflammatory storm has not set in. Once that is set in, I'm not sure how much remdesivir is available. It's like try everything policy hai. Hospitals ki, in logon ki. And obviously when it comes to their families, when it comes to relatives, sometimes people not think with that logic point of view. Anyone will do that. Even I might do that. But all I want to tell is people do not get disheartened in the severe stages if you have been asked to bring remdesivir and you are not able to arrange for it, because it actually will not help your patient. What drugs will help your patient in the moderate or severe stages is steroids. Steroids are highly cheap drugs, very easily available, and they have been the rampant to control your inflammation or cytokine storm right from the beginning.
Okay, so one thing is remdesivir does not cure COVID. The other is we have alternate options to remdesivir. So it's not like that is the only thing.
Remdesivir does not cure COVID. In treatment trials, it has been shown to decrease the hospital stay, has been shown to decrease the duration of the illnesses, might be helpful in some mild to moderate case, but definitely calling remdesivir as a life-saving drug is not true. It is not a life-saving drug. What alternatives to remdesivir are? There are steroids. See, again, they are not alternative because their mechanism of action is different. Now, steroids won't act on virus. They won't decrease the viral load, but they will decrease the complication of virus leading inflammation and everything. So, therefore, if the patient, if on day 4, day 5, he still continues having fever, it's better to start him with steroids. If he continues to having respiratory, some cough, congestion, heaviness, better to start inhalational steroids in the form of nebulizations and nebulizers. So that should be that treatment strategy, and that is what being is followed in my institute and what I've seen since a long time.
Can you name some steroids that people can get access to easily?
So all these steroids are easily available, very cheap, and there are a number of steroids. They are omnacotil, prednisolone, Medrol, that is methylprednisolone, deflazacort, dexamethasone. So all these steroids are cheaply available, easily available in both oral as well as injectable form. And short-term steroids does not cost. See, now if I say, then steroids have a large number of side effects. But then these things should not be started by the patient himself. If a patient is being started steroid, then he has to start under a physician after the advice of his doctor only. Because then steroids leads to hyperglycemia, raised blood sugars, diabetic patients might have complications. So all these treatments, whatever it is, has to be started under the observation of a physician, of a doctor only.
Correct. So just to clear this, so everyone who's listening should not go and buy every medicine that has been name dropped here. The first thing is obviously to get an advice from your doctor. So it's not like every medicine that you hear, you have to go and buy and hold it.
The punchline is day 1 fever, day 2 fever. We all know the symptoms of COVID. They can range from headaches to loss of taste, to loss of smell, to bowel upset, to diarrhea, to fever, to body pain. You have it. Day 1, day 2, consult a physician. Take a treatment under his supervision.
Sushant, I have a question for you.
Yeah.
Yeah. So where do you stand on
please.
The current ruling government's policies that is the current government helping, or can they do better?
No. See, then again, I'll say the thing which I said in start. In the first year, COVID was new for everyone. It was new for the government. It was new for the health ministries. It was new for the doctors. It was new for a nodal agency known as ICMR. Many of us, we have never faced a pandemic in our life. So obviously, we won't have the laboratories. But gradually from one laboratories, we progressed. Although I will say not at a speed we should have, but we did. So there have been hiccups in the path. But I mean, any day we can say the government has to do better. Come on, this is the responsibility of the government. So although government is playing its part, but at this time, anything is done is less.
Right.
So I think handling the pandemic, I will not say that government is at fault 100%. Neither I'll say the government is doing great, because absolutely, as we are seeing people dying, people not receiving oxygen. So I'll say government is doing its part, but anything I've done this time is very little too less, and they need to do more.
And what do you think about how people are reacting to this? For example, as I said, we are a very religious country. So even though all of this is happening, you must have seen events like these, religious events, wherein people are still going, they're still crowding everything, and they don't care. So do we have to blame the government for this, or it's on us?
No. So we just cannot blame everything on the religious gathering or religious outing. Has the political rally stopped? It has to come from the captain of the team. No, you can't. If the front bencher is doing, you can't blame the back benchers for doing it. No? It has to come from the captain himself. It has to come from the government initiative that no political rally. If people are saying, come on, if I am saying to people, don't go, don't get married, don't go there, people are saying, and people are genuine in their demands. People are saying that we are going out for a daily income. If we don't go, we won't earn. But this government who is carrying out large political rallies, and that I'm not speaking only the government, every party, it's across the spectrum, the huge rallies, the huge mobs which we've seen this time has to be blamed for. And everyone doing that has to be accountable for it. So blaming only on the religious gathering, yeah, religious gatherings are obviously not required at this point of time, and they should be certainly. But then the blame should be on everything. Blame should be of even for the marriage gatherings. Blame should be for the political gatherings. Blame should be. I mean, you can say or you can say not, but yeah, the government has to have this thing sorted, and they should have acted in this manner. I think some initial hard steps should have been taken, like they are taking now. Like now they have, after the elections have been over, they have placed curfews and restrictions across West Bengal. But these all steps were required at least a month back.
Yeah, because now the elections are over. That was the condition.
Now the elections are over.
Okay, so moving on from medicines, let's get into vaccines. So right now we have two in our country, right? Covaxin and Covishield.
Yeah.
And people are also debating on that because there is one debate which is vaccines ? The other is if people pass through that question, then it's Covaxin or Covishield. So can you tell us more on that?
Okay. So I'll keep this segment non-scientific because I don't want to go in the mechanisms of the mRNA and the DNA and the viral attachment and everything. Because I mean, that is all available on internet. All I say is based on my experience, what I've seen in last 3 to 4 months is, yes, vaccines are very useful. Everyone should take it. One, vaccines might not 100% get COVID infection again, as many of our doctors and everyone has seen. Either you will get mild infection, asymptomatic, or even with a number of comorbidities you will make it through it. It definitely decreases the hospitalization, the morbidity, the mortality associated with COVID. Any vaccine. This manner, your next question, I'm sure will be which vaccine to go for, the Covishield or Covaxin.
Right. And now we have a third option too.
Take any vaccine available to. Both are Sputnik 5. Yeah,
Sputnik 5.
I just now read that it has been landed in India. So,
correct.
Yeah, so all these vaccines have more or less the similar mechanism. It alters the virus proteins attaching in the body, makes antibodies against those viral antigens. So more or less the mechanism is the same. More or less the efficacy is the same. One is 70%, one is 80%, one is 85%. But then all these also depends on the person immune response towards the vaccine. So get any vaccine you get it ASAP. There should be absolutely no myths regarding vaccine. The only major contraindications, सिर्फ उन्हीं केसेस में वैक्सीन नहीं लेना चाहिए लोगों को, एक प्रेगनेंसी, दूसरा लैक्टेटिंग मदर्स, वो भी इसलिए because there have not been enough trials on them. Might be in future the vaccines will be available to those population also. At present they are kept out of it because there have been not certain significant trials or data in them, and we can't give those populations considering the vulnerability of the country in them. Third, only people having major allergic conditions to the components of vaccine, and obviously children less than 18 years of age. Apart from this, I don't find any other contraindication, any other excuse of not taking vaccine.
Some people have one. Some people think that if they have COVID and now that they have recovered, they don't require vaccine. How true is that? Because they think they already have antibodies, so they'll be safe. But obviously, we have seen the exact opposite. But
see, for this, I'll say that in our hospital initially, what we did was that once this COVID vaccine came initially, all the people who would recently got infected with COVID, we did the antibody titers of those patients prior to giving the vaccine. And surprisingly, or I'll say not surprisingly, because we expected that antibody titers prior to vaccine, even those who have got infection were not that much. Because your antibody titers depends again on your immune system, how much the viral load was, how much your body system was able to fight those viruses. All that depends on the immunity you get after you acquire the infection. But in vaccine, we know that a certain significant amount of inactivated viral antigen has been injected. And by the experiments and the trials, we know that this is the normal response of the people. See, again, I'll say might be one less than 0.1 people, patients who might have decreased antibody titer even after vaccine. But then it depends on your body's immune status also. So all these trials, they have a marginal error of 0.1, 0.2 of saying that some might or some might not even develop antibodies. But then when we talk about pandemic, we have to talk about the global scenario. We have to talk about the much larger population infected. And in that case, certainly these vaccines do help. And even a patient who has been infected with COVID should take vaccine 2 to 3 weeks after recovering from it.
Okay, so the thing is, even if you take vaccines, like if you've completed both the doses, there are chances that you might still get COVID, but that is not what the vaccine is for. It'll decrease the mortality rate. So if you don't want to die from COVID, you'll have to take the vaccine.
Right? Definitely, you have to take the vaccine. See, so vaccines are RNA vaccines and DNA vaccines. Right now, what in India we have the Sputnik 5 and the Covaxin and Covishield, which are generally the DNA vaccine, and the only mRNA-based vaccines are the Pfizer and the Moderna vaccine, which requires stringent measures of vaccine transport and vaccine storage, which is a bit difficult in a resource-deficient country like ours, like where we have such difficult terrains to supply such scattered populations, such remote areas, and the vaccine cold chain, which is major importance for the vaccine's efficacy, has not to be compromised. So for that, still these Pfizer and biotech companies which have mRNA vaccine, which are supposed to be so-called superior and with efficacy of 90 to 94% in different parts of world, they are still not available in country. But apart from that, all these, the basic two vaccines, the indigenous Covaxin or the Covishield, as well as the recently imported Sputnik 5, I think if the government agency, DGCI and everybody, ICMR has given the note, then I think we should trust our medical councils and we should trust our nodal agencies for it.
Yeah. So continuing where we left off, what do you think about the methods used for data collection for developing vaccines? Like you must be aware with the Tuskegee experiment and what happened with syphilis.
No, frankly speaking, I'm not much aware this time how the trials were done, and I can just tell you there are 3 to 4 phases of trial. Phase 3 phases are done in any trial of any drugs before the drug reaches the market, and there is this phase 4 trial which is done when the drugs are in the market and to see their overall safety and efficacy. So there are 3 stages. The first stage is initially stage 0, that is done in the animals. Stage 1, which is done for the safety of it, and stage 2 and stage 3 in the healthy and the infected population is done. In stage 2, the sample size is small. In stage 3 trials, there is a large sample size of the infected people, all the vulnerable population that is done. So irrespective of any drug or vaccine, the stages of trial remains the same. Now, I don't have that much knowledge of how these both companies have gathered their data and what were their populations and which statistic methods they used. I mean, that is for our government authorities, DGCI and ICMR to consider. And I think once their board has passed it, I think we should not be questioning it.
Okay.
Regarding COVID vaccine, all I can say that when done in any country or in India, the volunteers, they get to sign a preformed certificate or a paper in which they have been already informed that this is a trial and experimental drug yet to be confirmed safety or efficacy or long-term effects in large number of populations. And after knowing all the pros and cons, only patients are voluntarily selected.
Okay.
There is no monetary remuneration which I know of was being offered to patients, at least in India, who were enrolled for the Covaxin or Covishield trials, and all the patients enrolling were given a uh, informed consent about them being enrolled in the trial.
Mm-hmm.
So I don't think a very, very rare side effect of increased thrombosis, blood clots were detected. And due to that uh, contraindication, or I'll say due to that complication, there are few European countries and few Western countries that have banned use of Covishield. But I think, again, that is if we say ki 1 in a 10 million complication.
Right.
But then
Okay.
that complication is for any drug. That is, even if you step out on the road, 1 in 10 million, you're got to get hit.
Okay.
But then again, thinking about the benefits more than side effects. So all these vaccines definitely beat that. At this point of time, all we need to consider is benefits more than side effects. If benefits are way outweighing side effects, which is the case with this vaccine, I think people should go for it.
Okay, being on the subject of risk with the vaccines. So, what are your thoughts on us? So, there's this saying that we burn the house down to save it from the plague. So, in that context, do you think shutting down the whole country is a viable option? Because people are losing their livelihoods, businesses are shutting down. So, what do you think about that? Ki there is risk, and I think risk should be a personal choice. There is risk in like stepping out and walking on the road. So I think if I am willing to take the risk to go and work, even when there is COVID out there. So I should be allowed to take that risk. What do you think about that?
See, this is not a personal choice anymore. You are doing a collateral damage, because it's not only you are getting infected, you are infecting others. You might infect a person who's sitting in your family at your house who is not stepping out. But coming back to him, you are making him in danger. There are people of essential services out on the road. You might be asymptomatic, you might be carrier, but you might be infecting them. So
Right, I
it's,
agree.
my
So,
friend, in this pandemic, there is no more a personal choice of you going out and you working and only you getting harmed.
right. So here, I think I agree with you, because right now, the current situation, I don't think we no longer have a personal choice that we can go out and do whatever that we want to.
Okay, well, I just think that risk should be a personal choice rather than.
No, but when this is a pandemic affecting millions of population, then definitely it is, because your actions are harming the society. If your action would have harmed yourself only, still we say in India that taking even your life is not allowed.
So what
Even
do you?
that is not
Yeah.
legalized.
Yes, for now
So
it's not.
here so here, for individual action, a society, a community, a country might suffer. So in this case, there is no longer a choice of a personal, no longer a question of personal choice or only a person being infected.
So what do you
You
think?
have to look at it in the larger prospect.
So what do you think about the economy getting hurt due to this?
See, now again, वही है ना. अभी now you tell me the way to stop people getting on the street. कल को you say कि only the people who have to go on their jobs are going, but then you know कि we as in Indians हमें मजा आता है, because the thing is कि there is a term known as social distancing. See, we don't believe in social distancing. The appropriate word for COVID should be a physical distancing. Socially and emotionally, we should be in contact with each other.
True.
We, and moreover, Indians being social people, you allow the economic activities. If you allow, you'll see the marriages happening, then you'll see the gathering happenings, and the priest will say his economy, his earning is through the people coming in the mandirs and the masjids and the churches. So then you need to allow them also. Somewhere you need to draw the line. See, I'm not in favor of total lockdown. The economy is being burdened. The people livelihood, there are daily wage workers which we've seen are suffering. But then when somewhere we have to break a chain, and I don't think right now government has any good other alternative option. See, this time also lockdown was used as a last resort. ऐसा नहीं था कि शुरू होते से ही every government has put the lockdown. In fact, UP government, I think it has put the lockdown since today, since a month, since 1.5 months. They were, telling them that they were dividing the city from the lockdown. But then when they saw the number of infected getting overflowed than the resources the city has, so somewhere it had to take this as a last step, last resort.
Right, and I totally agree with your one line, which I think has to be highlighted. The current situation requires you to be socially and emotionally connected. So rather than an emotional distancing or social distancing, this has to be a more of physical distancing. But socially, emotionally, we have to be connected. Right?
Yeah.
Okay, so I think we can move from vaccines now. And moving on to vaccines, all of these things are what we could do to protect ourselves. Now, let's talk about plasma donation.
Before we get to plasma, one more thing I'd like to ask: what are the dietary additions one can do to their daily food intake so that they have a lesser chance of contracting COVID or like having severe infections?
See, preventive diet and diet after COVID. Preventive diet, I mean diet rich in proteins, nutrition, green leafy vegetables, fruits. The non-vegetarian people can continue to have eggs and fishes. So all these dietary patterns which help you to increase your immunity, help you to increase your fitness. The vegetables, the fruits, the normal household diet is good. Once you got COVID, diet differs because you have loss of appetite, you have loss of smell, taste, your body condition might not be allowed. Then the diet differs. In the patients with diabetic, we do not prefer less of carbohydrates such as roti, chapatis, and rice, potatoes, sugary foods has to be decreased. In rest of the people, we ask them to take a high intake of protein diet. Agar patient has a loss of appetite, he's not able to take large amount of food. So we say a small amount of food, but should be nutritious, a calorie rich diet should be given. So even if you're giving a dalia, add 1 or 2 spoons of ghee or oil, which will help to increase its nutritional, its calorie value. So you don't want to go in a calorie deficit state because ultimately your immunity body response depends on your health, your diet, your calorie. So if all these infectivity are, as it is a catabolic process, it increases your metabolic rate, it increases your calorie requirement. And if you take a calorie deficit diet, ultimately you're causing more harm than good. So, well-balanced diet, considering the different age group or different demographic of the population, diabetic or non-diabetic, hypertensive or non-diabetic, hypertensive, non-hypertensive, diet should be modified or selected according to that. But the baseline remains the same. A highly balanced diet consisting of good amount of green leafy vegetable, fruits, proteins, decent amount of fats should be taken. And hydration is very important in all the stages of disease, irrespective of the disease spectrum. 3 to 4 liters of fluids, which includes water, soup, ORS, anything of such sort should be consumed by patients or even before acquiring COVID as a preventive measure.
Right. And this is for every other thing. So despite the fact you have COVID or not, these are things that you should actually take care of. Right.
Yeah. I mean.
Okay, so now there is one thing that troubles me a lot in this entire COVID situation. I think we also discussed this yesterday. It's about plasma donation. So you donate plasma when you have recovered from COVID, right? And I was reading as of 20th April, 0.7% people have donated plasma. The thing for which everyone is crying online and offline. And still only 0.7 people have donated plasma. Not even 1%.
I'd like to ask what exactly plasma is and how does it help a COVID patient?
So I'll break your question into 2 parts. What is plasma, what is its use, and how does it help in COVID? Again, plasma or any immunoglobulins have the antibodies. These antibodies bind to the viral antigens and decrease the viral load as well as the immune response of the body. Same as steroids. As steroids, as I told you, that it decreases the immune responses, decrease the antigen and antibody reaction. Similarly, these plasmas, they contain of antibodies and the neutralizes the viral antigens. Now, these plasma, not a very large scale trial has been done. Initially, it was included in ICMR guideline, or even ICMR has removed it. But what I feel is this plasma is also only useful in the initial few stages in mild to moderate diseases when there is not much robust immune response, where the patient is still on room air or on limited oxygen supply. Plasma, if given at this stage, will only work. Giving plasma at the severe stages of the condition where your 75% to 80% lungs have been infected, giving plasma at that time will do more harm than good. It will lead to paradoxical increase in the thrombosis, and coagulopathies might increase, and patient might have deteriorating effects of plasma given at the latest stage of the disease. So this also might thing needs to be addressed, and giving these therapies such as remdesivir or plasma has to be given in the initial few stages of the disease. And that too, I am saying, not in case of asymptomatic or mild disease, a moderate disease, or even with mild disease with impending respiratory failure, or where the patient requires minimal oxygen support. Giving plasma, if it is of any use, will help in that stage. So a lot of patients who are actually critically very severe with their CT severity scores of 23 or 24 upon 25, or more than 16 or more than 20 on 25, trials have not been shown to, that plasma can improve the condition or the mortality or morbidity. In that condition, your antibiotics and your anti-inflammatory drugs such as steroids or maybe even tocilizumab, they might work, but certainly not plasma, not remdesivir.
So we can say that for now, plasma is not as important as people are making it, right? So even though
plasma is important in certain conditions, but I don't know. What I see is for any severe condition, any stage of the disease, people have been either counseled or फिर वही बात होती है ना कि when the things are going not in your hands, you try everything policy. So in that case, you might do more harm than good to the patient also. And also the plasma, which could have helped a person in his initial stages, he might also get devoid of that plasma, is what I think. So in a resource limited country like India, we actually have to ration our resources, at least at this point of time, when we don't have surplus amount of resources.
So coming to the resource problem, I don't think we have like scarcity of plasma in here. I think we have a lot of plasma that can be donated, right?
Yeah. So coming to the second part of your question, with more than 1 crore 50 lakh patient recovered in a country like India, where we are still fighting for availability of plasma, something amuses me. कि plasma रख के भैया करना क्या है? I don't know what is the myth behind it. Some people say they might become weak or they might be again get infected by COVID, but it is not there. Once you have antibodies, you've donated, the body mechanism in its place, it will produce again. So I don't know what is the people's limitation, what is their mindset behind giving plasma, but giving plasma is absolutely healthy. It won't affect donor. It can save somebody's life. And in a country like us, where we have more than 1.5 crores recovered COVID healthy patients, except few comorbidities which are contraindicated in giving plasma, I don't think there should be any hitch or any second thought in patients or people recovering from it. I don't know. Same thing is with blood. Blood donation is again a thing which is not being taken seriously in our patients. I see in my hospitals how the leukemic patients and thalassaemic patients have to run pole to pole in order for arranging blood for their patients and relatives. So this blood and blood products donation in India has to be highlighted. People have to be made aware of it, that giving plasma, you can save somebody's life, and simultaneously it won't cause any harm to you.
Right. And also, blood and plasma are not something that has to be given only when they are asked for. Like blood banks, we also have things for plasma. So you can anytime go and donate it, and that can be used for later, right?
Yeah, obviously, yeah, every blood component has a shelf life. They have a storage capacity, storage life. So anytime you want, you can go to your nearest blood bank. You want to go to government hospital, there are NGOs, there are private hospitals, there are communities on social media who are arranging for your plasma donation, for your blood donation. I don't think in India, where there are 130 billion people, blood and blood products which can be easily donated by the people for free should be even sold. I mean, the hospitals should get it free and easily from the people. And if there is surplus supply to the hospitals, obviously they give free, including only the processing costs apart from it. So yeah, I think people should be encouraged to give and donate their plasma, especially if they've recovered from COVID and in such a condition. So,
And one question, if I'm vaccinated, can I still donate plasma?
yes, you can still donate plasma, but in that case, you need to wait at least for 28 days after your second dose for your
Okay.
antibodies to be formed, and then you can go and donate your plasma.
Okay. And according to what I have read, people that have been worrying that a lot of important vitamins will go out of the body if they donate plasma. I think
Nothing go.
45% of your blood. Yes.
Blood is devoid of all. Plasma is blood devoid of all these things. So when you give plasma, your blood cells, your nutrition, your vitamins,
Right.
they don't,
And plus,
get
they
into the
only take
plasma
out the
itself.
plasma from the blood. All the other things like the RBCs, WBCs, I think they are sent back to the body. So only
Are
plasma.
restored back to the body.
Yes, right, right. Okay, so I think you also have been like you are there in the present situation. You're on ground, so you're not just talking about what you're seeing online. You're actually there. You're watching it. You have already been infected. So tell us more about that. What's the actual on-ground scenario that I've been seeing in your hospital? You might have been meeting patients.
On ground scenario is a combination of fear, despair, insensitivity, and lack of knowledge, I must say, or ignorance. So the on ground scenario is a mix of this. The people who are suffering, they are actually the affected population, the affected people, the people whose relatives or who are themselves in the hospital, their condition is different, and the people on roads, their mindset and their thinking and ignorance level is different. So I mean, there are two stark worlds which we are seeing in this part. One is the people who till they themselves are not affected are out on the streets, maybe rallying, maybe whatever they are doing, and for them
Mhm.
corona might be a myth. But then for the people who have lost their near and dear ones, or who are in the hospitals or have been infected, they know the severity of this grim condition. I can't even tell you. I can't. It give me chills down my spine when I talk about this. The scenes which I see daily basis, and I've been in this medical field for now for 12 years, and I can vouch, even my seniors, consultants, professors who've been in this field for 40 50 years have never seen such scenes in their lifetime, and I hope nobody sees them. So yeah, it's scary,
Mhm.
but yeah, obviously there is hope at the end of the tunnel.
And okay, so you have been there, like I said. So what are the doctors doing? I know it's a lot of pressure on them, and still some people don't understand. They're lashing out on doctors, which is actually very heartbreaking. But you being there, you can speak for them. Like, what are you guys doing? What's happening there? What's your situation?
So coming to the very important part, and which part I want to highlight, because there are many people who will be speaking on the drugs and vaccines on this, but now I want to speak about the medical system in our country, because I've been from the bottom to here. So I've done my 12th and I've cleared the pre-medical test, then MBBS, then MD 3 years, then bond, and then DM neurology I'm doing, and final year. So I've been in this system for 12 to 13 years to tell people about the structure of the system.
Right.
So
And
how does
one
a hospital work?
respect I have for doctors is you guys study a lot. I have a friend who is pursuing this, and I know how hard it is. So first of all, a huge respect for that.
Thank you. So in the structure of a medical college or hospital, there is a person who's sitting on the top. He's known as a dean or director in different institutes by different names. He is the person who's directly in contact with the health ministers, the chief ministers, the nodal agencies, and he is the captain of the ship. He is the person who decides what needs to be done, how it needs to be done, from where the resources have to be generated, from where the resources have to be utilized. So that is his job. Below him, there are the number of people. There may be a nodal officer appointed for the COVID-related purposes who directly reports to the director. Then there are the head of different departments in a hospital. And there then comes the residents. The residents are the students who are doing either their post-graduation course, the MD students, or who are doing their super specializations, the DM courses. If we say they are the foot soldiers in the war, and as we know that every war is won on support of the foot soldiers only.
Right.
So since
I
the
like
beginning of this pandemic,
how you have referenced them as foot soldiers, because in army, foot soldiers are the one who go out with all their guns in battle. So I think it's exactly the same thing.
They go out without the guns in battles, and they are the persons who are maximally harmed, who are the person who have maximally have to pay the brunt of it, and still have smile and get the least amount of recognition. I mean, how many we've seen the foot soldiers getting recognized for their victories, for their jobs in the war, and as compared to the senior officers. So similarly, since the brink of this pandemic last year, since more than 1 year, residents across the nation, across the specialities, it doesn't matter. You are a gynecologist, you are an orthopedician, you are a neurologist, you are a pathologist, you are an intensivist. The aim of everyone was to fight corona pandemic in whatever capacity they were trained. If you were trained in pathology and microbiology, those people, apart from the normal testing and sampling, they gave duties in the normal COVID wards. The group of intensivists, the pulmonary care people, the medicine students used to work in the ICU. So similarly, despite of your specialty, सब भूल गए थे और भूल गए हैं कि कौन क्या था, कौन क्या पढ़ने आया था. All our aim and our efforts since last 1.5 years is to fight the COVID pandemic, and I'm sure across the country, अगर एक साल और भी ये चलता है तो सारे residents खुशी करते रहेंगे. So this is what we have trained to be, and this is what we have. Everyone who's become a doctor, his aim has been and his dream has been one and only: to save people, to save life, to bring smile. So that is what we've been doing since last 1 year, and jab tak chalega, aage bhi. I mean, all the residents fraternity across the country will do so. The only thing which hurts me and hurts everyone is when they see that despite of all their efforts, the lack of gratitude, the lack of appreciation, and the ignorance from their own administrative things. Recently, 2-3 news, I don't know how true they are, but I came across on social media that residents in their own hospital were not getting beds for them or their family members.
Right, I've heard that too.
So this thing should not be there. I mean, if suppose the residents are not safe, their family members are not safe, how can you expect them but despite of such conditions, they have been able to maintain a total positive frame of mind, and they're working tirelessly, and I'm sure they'll continue to do, because foot soldiers, they are known to follow the orders to the core. So we'll fight, but all I want is from people a bit of gratitude, a bit of appreciation, and a bit of understanding. I know the tempers rises maybe from both the sides, but then when we are fighting a war on the basis of our foot soldiers, how you will justify people beating your own soldiers? So the instances of people beating doctors, people bashing doctors, political bashing doctors has not stopped in this country despite this pandemic. And
Right.
in this pandemic, one thing I want to bring in your notice, as you know, the hospital costs have increased, the medicine costs have increased, people making oxygen concentrators, they have increased their cost. But what has not increased is the
Doctor salary.
residents' stipend, doctor's salary, whatever consultancy fees, whatever stipend we were getting before, we're still getting. And in spite of several states who are not paying it on time also, then also residents have not. Because see, in this, when you work, money is secondary. We don't work for money. We work for only the patients, helping them how to get them better. That's what I mean to say. It has been such a selfless thing, not because of any force, but voluntarily. So all in return of it, we want some gratitude of people, authorities, and at least a soft corner for us in minds of our administrators and politicians.
Right. And this is in war. And how senseless is this to, harm your own soldiers in when you are in a war zone?
Yeah,
so it's
you
very
don't
similar to that.
harm your own soldiers. You don't beat your soldiers, and you know when you have limited resources. So कि आप hospital तो और बना लोगे. आप Dubai, US, UK से you will import the ventilators. You will import, but how will you make doctors? आप ऐसे नहीं किसी को ना कल को बना सकते कि चलो ये 4 डॉक्टर नए बना दिए. You have limited resources in your country, and वैसे भी in our country where we have one doctor from 10,000 to one doctor per 1 lakh population, depending on different parts of countries, where we have already limited resources, we need to utilize them in a better way. हम सहेज के रखते हैं ना, अगर कोई हमारी कोई धरोहर होती है, अगर कोई हमारी important चीज होती है, at least for time being तो हम उसको सजा के in the cotton bubble, in cotton wrap, मखमली कपड़े में हम रखते हैं. यहाँ तो I feel कि जो हमारी इस समय पैंडेमिक में सबसे बड़ी वो है कि आज strength at doctors, उनको ही लोग मार रहे हैं and not concerned about that. I mean, that should not be there. And this message I want to, if through every social media I want to propagate is, please respect the doctors. Everyone is giving their 100%. Everyone will keep on giving 100%. All matters to us is saving the life of every patient we get, every person we are able to do. All we require is your support and a bit of smile, appreciation, and a place in your heart for us.
I hope this knocks some sense into people, because it's really unfair.
Yeah.
I can see how emotional you were talking about this, but let's see. We can just hope and pray, and I hope people get this.
Yeah.
And not to forget, you have to go on a shift duty, I think, after this podcast, right?
No, I need to take, as I told you, I'm still on day 10 quarantine after coming positive. So right now I have to take few calls of the patients of COVID. So I've given them 6:30 to 7:38 time where they generally call me. So yeah, I have to get back to it.
So huge respect, sir. Thank you for doing all of this. Thank you for coming here and talking to us. Thank you for sharing every plight that you have in. I know you have been ignored. Thank you so much. The doctors have been ignored, but I hope this knocks some sense into people.
Sure.
Thank you. Thanks a lot for doing this.
Okay, yeah.
Sushant, I'll just stop the recording.